Welcome to the Learn Pediatric Screening Neurologic Exam. This is an exam that is often viewed with trepidation by non-neurologists due to fears about the complexity of many of the special tests. While it is true that some of the techniques require advanced training or equipment, most can be easily performed by general physicians in the office setting. In this video, we will demonstrate an approach to examination that will highlight key techniques and allow you to feel comfortable examining children with neurologic concerns. There are 6 components of a neurologic exam that we will review. These are the systemic exam, mental status, cranial nerves, the motor exam, the sensory exam, and the cerebellar exam, including observation of gait. How much time and detail is dedicated to each area varies with the presenting complaint. Let's begin with the systemic exam. The neurologic exam begins when the patient first enters the room. With toddlers especially, watching the child when they don't realize they're being observed can give you valuable information.
Hi, if it's okay, we're going to be doing a neurology exam with you today, Michaela. Does that sound all right? Good. Could I ask you to come around here and hop up on the bed for me?
Begin with a full set of growth parameters plotted on an age-appropriate chart. These include height, weight, and head circumference. To measure the head circumference, a tape measure is placed on the occiput and brought anteriorly to just above the eyebrows. 3 measurements should be done, and the average of these taken as the head circumference. A smaller or larger than normal head circumference can be a sign of underlying pathology. For example, a small head circumference, or microcephaly, can occur with intrauterine infections or chromosomal abnormalities. A large head circumference, or macrocephaly, can be the first sign of hydrocephalus. Head circumference should be measured at every physician visit until children reach the age of 3 to determine the rate of growth. If a child's head measures outside the normal curve, the head circumference of both parents should also be taken to identify the possibility of a benign familial pattern.
Go. Perfect.
All of the body systems should be at least afforded a screening exam. Nearly any systemic abnormality can be associated with impaired neurologic functioning. In this section, we'll describe a few of the key findings to look for.
We're going to listen to your heart and lungs, all right?
Particular attention should be given to the cardiac exam. Children with cardiac conditions are more susceptible to neurologic injuries, such as strokes. To review how to do a complete cardiac exam, please refer to the Learn Pediatrics video on the cardiac examination.
I'm just going to lift this up a little bit and listen to your heart, okay? Can you just lift up? Perfect. I'm going to come around to the back and listen to your lungs. Take some nice deep breaths in and out for me. Good, that sounds great. So we're going to take a look at your belly now. Would you be able to lie down on your back, head on the pillow? Good job. Yep, perfect. Let's take a look at your belly. Good. You let me know if there's anything that hurts, okay?
On abdominal examination, note any hepatic enlargement, which may be a sign of an underlying metabolic disease. To review how to do a complete abdominal exam, please refer to the Learn Pediatrics video on gastrointestinal examination. The neck should be examined to ensure that it is supple and that no meningismus is present. Specific physical tests for meningeal irritation include Koenig's and Brudzinski's test. Koenig's exam is usually performed with the patient supine and the knees flexed. An attempt to straighten the knees is made. The inability to extend the patient's knees beyond 135 degrees without causing pain constitutes a positive Koenig sign. Brudzinski's neck sign is performed by placing one hand behind the patient's head and the other on the chest while the patient lies supine. One hand flexes the patient's head towards the chest while the other restrains the patient from rising. Flexion of the lower extremities, hips and knees, constitutes a positive sign.
Say that for me. Swing your legs over any bumps or bruises or birthmarks that you have?
As the
anywhere?
skin and central nervous system both develop from the ectoderm during embryogenesis, a full examination of the skin should be undertaken. Hyperpigmented lesions, such as cafe au lait spots of neurofibromatosis, and hypopigmented lesions, such as ash leaf spots in tuberous sclerosis, are best seen with a Woods lamp.
Jump down for me.
The Woods lamp exam is performed using a black light to look at the entire surface of the skin.
So I get you to bend down.
Also examine the back for scoliosis or a patch of hair, which may indicate an undetected vertebral anomaly.
Very good. Up we go. All right. Have a seat.
Mental status exam.
Okay.
The neurologic mental status exam is designed to test the various components of higher brain function.
So we're just going to do a few question and answers now, okay?
This encompasses functions such as memory, thought perception, understanding, and intellect.
All right. So
The psychiatric mental status exam will not be covered here.
Michaela. And what grade are you in?
The assessment of mental status must be tailored to the age of the patient.
I go to Nestor Elementary School.
Good.
For younger
And what
children,
grade do you?
screening can be done by assessing
Friday,
whether
July
the child
9th,
has met their
2010.
appropriate developmental
Very good.
milestones.
All right, now we're going to test your memory a little bit, okay? So I want you to remember 3 things for me. And those 3 things are cat, church, and blue. Can you say them?
Young
back for
children
me?
are best examined through observation of play and by careful questioning of the parents.
Because I'm gonna ask you
A history of loss or plateauing of developmental milestones is a red flag that must not be ignored and needs to be investigated fully.
and then I want you to
For children 7 years or older, a more formal screening test such as the Folstein Mini Mental Status Exam may be used. Modified versions of the mental status exam are available for children. The components of the Mini Mental Status Exam are designed to allow evaluation of cortical function. Higher functions usually require integration of several areas. It is therefore difficult to state that a problem with one test corresponds directly to an abnormality of a specific area of the cortex. Accepting, therefore, that it is an oversimplification, we will try and identify which general area of the cortex is being examined with each test.
And some of the questions might be really easy and some of them might be tough, but just try your best. Okay?
Orientation questions test several areas at once, including language, attention, and memory.
And what grade are you in, Michaela?
I'm in
Attention and working memory is primarily coordinated by the frontal lobes.
Elementary School.
Other components of frontal lobe function include motivation, behavior, and executive function. Such as would be tested by ability to follow a multi-step
The
command.
next thing we're going to do is a little bit of arithmetic. So what I would like you to do is we'll start at 20, and then I want you to subtract 3 every time and keep on subtracting 3. So we'll start at 20 minus 3 is?
17,
Hmm.
14, 11,
Mathematical calculations are primarily
8.
controlled by the parietal lobe.
5, 2.
Perfect. All right, so now we're going to take a look at a couple of things, all right? So, first question.
Naming of objects requires integration of several areas but can be used in conjunction with visual field testing and naming of colors to identify problems with occipital lobe function.
Good.
Naming of objects by tactile recognition requires functioning parietal lobes, as it is the primary location for the interpretation of somatosensory information.
A key.
The dominant parietal lobe is responsible for planning motor functions. Visual spatial organization is also controlled by the parietal lobe and can be tested for by the ability to copy a design. Memory, especially declarative memory, is a function of the temporal lobes and their connections to the hippocampus and limbic systems.
Now, do you remember what those 3 things were that we talked about earlier? Can you tell them back to me?
Cat, church, and blue.
Very
Again,
good.
the distinction between where the frontal lobe contribution to memory ends and the temporal lobe takes over is quite indistinct. Language and speech centers are located in the temporal and frontal lobes. On the dominant side, Wernicke's area is located on the superior temporal gyrus. This is the primary center for receptive language. An abnormality of this area manifests as a fluid aphasia, where comprehension is impaired and speech, while clear, is often meaningless. Broca's area on the inferior frontal gyrus is responsible for language expression. Patients with problems here are able to comprehend speech, but have difficulty forming words. Problems with the non-dominant hemisphere can manifest as difficulties with the rhythm of speech. Cranial nerve exam. Abnormalities of cranial nerves are often helpful in identifying problems in brainstem function. The three areas of the brainstem, the midbrain, the pons, and the medulla, each have corresponding cranial nerves originating from them. Cranial nerves 3 and 4 start at the midbrain, 5 through 8 in the pons, and 9 to 12 in the medulla. Cranial nerves 1 and 2 start in the cortex. Only cranial nerve 4 truly crosses the midline, and so problems with the other cranial nerves localize to the ipsilateral side.
So we're going to test your
Cranial nerve 1.
So what I want you to do,
Cranial nerve 1, the olfactory nerve, is purely sensory
totally block it
and
off.
is rarely tested in the screening exam. If there are any concerns raised in the history of a change in taste or smell, each nostril should be tested separately using a non-noxious smell such as mint, orange, or vanilla.
So block the other one.
The ability to smell the substance is more important than the ability to identify it correctly.
Good job.
Cranial nerve 2.
So, we're gonna start
Cranial
on
nerve 2, the optic nerve, carries all sensory visual information to the cortex.
buses or anything?
The first step in examining cranial nerve 2 is to determine the visual acuity of each eye.
Get you to cover one eye.
This can be done with a wall-mounted Snellen chart or with a handheld card.
Okay. Now, can you read the bottom letters?
There are also age-appropriate charts with pictures for younger children.
Excellent.
If the child wears corrective lenses, they should wear them during the visual acuity testing.
H.
Once the acuity is determined, color vision is
All right,
tested.
so now we're just going to check your color vision.
Proper color discrimination requires the presence of normal cone
Tell me
function.
what color that is.
If you do not have a formal color vision test, such as the Ishihara plates, you may ask the child to identify a green object and a red object.
Yeah, good. All right, one more. Okay, cover one eye. How about this one?
Green.
Huh? And now try the other eye. Does it look the same from eye to eye?
Pupillary response to light
Use the light
tests
now.
cranial nerve 2 for the afferent portion and cranial nerve 3, the oculomotor, for the
You
efferent.
can see. Just
Shine the
shine
light
it
directly
down,
at the pupil
okay?
and watch for
So I want you
direct
to
as
look
well as
at the
consensual
distance
response.
there, and just
The
keep
swinging
on
flashlight
letting
test
your
is
eye,
done to
okay?
test for a relative afferent
Ready?
pupillary
Yes.
defect. This test is done by shining the light first at one eye, then the other, and watching for a change in pupillary size.
And we're going to do that
If
one
one
more
pupil
time.
is
Back
larger
and
with
forth,
direct
all right?
stimulus than with consensual response, then that eye has less light perception than the other. Fundoscopic examination is a very important component of the cranial nerve 2 exam. The optic disc, vessels, retinal background, and fovea should be visualized for abnormalities. This can be quite challenging in children, requiring speed and creativity in distraction techniques. If there's concern about abnormal findings, a dilated exam should be performed. To examine the child's right eye, use your right eye and hold the fundoscope with your right hand. Similarly, use your left eye and left hand to examine the child's left eye. A fundoscopic view of the eye is shown here. Finally, visual fields are tested. There are several methods for this test that are all effective. The key is to ensure that all 4 quadrants are tested in each eye at their outer limits. More accurate formal perimetry testing is available if a problem is identified. Field deficits can be used to localize problem to pre- or post-chiasmal, optic tract, optic radiation, or occipital cortex. Cranial nerves 3, 4, and 6. Cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens, are tested together with the motor component of cranial nerve 3 through testing of eye movements. Cranial nerve 4 controls the superior oblique muscle, and cranial nerve 6, the lateral rectus. Cranial nerve 3 controls all other muscles of extraocular movement. Ensuring that cranial nerve 6 is intact is especially important in cases of suspected increased intracranial pressure. Due to its long length, cranial nerve 6 is often one of the first nerves affected as pressure increases. Start by inspecting the child's head position to ensure that it is straight, when both eyes are looking forward and that no ptosis is present. Have the patient follow a finger or object to the extremes of the visual fields to test pursuit eye movement. This is best done using an H-shaped pattern. At the end of this pattern, test convergence by having the child focus on a finger as it is brought close to them.
Good, that one's silly, huh? All right, and can you just look straight at my nose, look straight ahead? Very good. Now I'm going to hold my finger here, and I'm going to hold my thumb up over here. And I want you to look from finger to thumb when I ask you to, okay? So look at my finger, and look at my thumb.
Saccades are tested by having the child alternate their focus rapidly between two objects in both the horizontal and vertical planes. In both saccadic and pursuit movement, watch for nystagmus at the extremes of gaze.
Finger, thumb, finger, thumb. Very good. That was
Cranial nerve 5.
okay.
Cranial nerve 5, the trigeminal nerve, has both sensory and motor
We're
components.
just going to test.
The sensory component can be tested using light touch and temperature bilaterally on the forehead, cheeks, and chin to examine all three of the peripheral divisions: V1, the ophthalmic division; V2, the maxillary division; and V3, the mandibular division.
Okay, start again. Same.
Testing the muscles of mastication, as well as for the absence of the jaw jerk, examines the motor component.
Hard.
Cranial nerve 5 also carries sensory information from the cornea via the V1, thus carrying afferent information of the corneal reflex, while cranial nerve 7 carries the efferent component.
Very good. Okay, and I'm going to put my finger on your chin, and I'm going to tap it. Okay? Good. And that's all it is.
Cranial nerve 7. The functions of cranial nerve 7 can be summarized as face,
So I just want you to
ear,
kind of do what I
taste,
do.
and
Okay?
tear.
First thing, lift your eyebrows.
Specifically, the facial nerve innervates the muscles of facial expression, the stapedius muscle of the ear, taste to the anterior two-thirds of the tongue, and the parasympathetic supply of the lacrimal glands. The muscles of facial expression have an interesting pattern of innervation in that the upper portion of the face is innervated by both the right and left cranial nerve 7, while the lower half is entirely the ipsilateral nerve.
Very good.
Cranial nerve 8.
Hearing a little bit.
Cranial nerve 8, the auditory nerve, is screened by testing hearing.
Three sounds in my hand.
If hearing in one ear is decreased,
Okay?
the Rene and Weber test can be done to distinguish a conduction versus sensory neural deficit.
Now there's some
The
special
Rene
tests to
test
do with
compares
hearing.
conduction of sound in air with that of bone.
And it's
A
basically
tuning fork is first held in front of the ear and then held to the mastoid process.
So what we would do is I would hit it.
Bone conduction is louder in conductive problems, while sensory neural deficits yield the same result for both, or perhaps slightly louder for air conduction.
Very good. Okay. Same thing. We'll test the other ear, okay? All right. Tell me when you don't hear it buzzing anymore.
Now.
Good. Do you hear it? Do you feel it buzzing there?
No.
No. All right.
In the Weber test, a tuning fork is placed on top of the head. If hearing improves in the deaf ear, a conductive problem is present, while if true sensory neural deafness exists, there will be no change.
Good.
Cranial nerve 9, 10, and 12. In the screening exam, cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus, are tested together via the gag reflex. The afferent component is carried by cranial nerve 9 and the efferent by cranial nerve 10. Cranial nerve 9 also carries taste from the posterior one-third of the tongue and autonomic innervation of the salivary and parotid glands. Speech and pronunciation tests can be done to test the recurrent branch of the laryngeal nerve of cranial nerve 10, in conjunction with aid from cranial nerves 5, 7, and 12.
Side to side. Very good.
Cranial nerve 12, the hypoglossal nerve, controls tongue movement and is tested at the same time as 9 and 10. When the child's tongue is at rest in the mouth, the tongue should also be inspected for fasciculation.
Okay?
Cranial nerve 11. Lastly, the spinal accessory nerve, cranial nerve 11, is tested through its control of the sternocleidomastoid and the trapezius muscle.
Can you lift your shoulders up like this? Don't let me press them down. Keep them nice and strong. Perfect. Just relax your shoulders. Good. And now we're going to test your neck muscles, okay? Look over at that curtain over there. Yeah. And now I'm going to try and move your head. And don't let me move it. Keep it strong. Very, very, very strong. Good job. And now the other side. Good. Keep it very, very, very strong. Good job. Okay.
The motor
Go ahead and
exam.
just relax your arms.
After cranial nerve testing, begin the examination of the motor system. There are 3 components of the motor system tested during the screening exam: muscle strength, tone, and reflexes, including the presence or absence of pathologic reflexes. In the screening exam, testing all 3 modalities in first the upper extremity and then the lower extremity can help save time and can help localize abnormalities if they're present. The anatomy of the motor system can be separated into upper motor neuron and lower motor neuron components. The upper motor neuron includes the corticospinal tract and connections to brainstem motor nuclei. The motor system is also strongly influenced by the basal ganglia and the cerebellum. Classically, lesions of the upper motor neuron present as loss of muscle strength and dexterity distal to the injury, a Babinski sign, increased tone, and hyperreflexia. Remembering that the corticospinal tract crosses at the pyramidal decussation, upper motor neuron lesions will present with contralateral deficits for lesions above the pyramids and ipsilateral deficits for lesions of the spinal cord. Spinal cord lesions will also present with lower motor neuron findings at the level of injury due to damage to the ventral root or ventral nerve at that level. Lower motor neuron lesions result in muscle fasciculations and atrophy, loss of strength, decreased tone, and absent deep tendon reflexes.
Okay.
Begin the physical exam by inspecting the limbs for symmetry, muscle bulk, and
Take a
posture.
look at the muscles in your hands. Okay. Muscles here. Look for any extra movements. Good. Now I want you to go nice and floppy. I'm just going to move your arm around, okay?
Tone can be assessed by passively taking the limb through the range of motion. Spasticity, an upper motor neuron sign, is felt as an increase in tone that varies with the force applied and the velocity of movement.
All right. Now you need to
Rigidity is increased tone that does not vary with velocity or position.
up like this. Put your arms up. Don't let me press them down.
The strength of each muscle group should be tested and graded from 0 to 5.
This. Don't let me
Begin with examining arm abduction. Always remember to compare side to side.
Now I want you to
Then proceed with elbow flexion, elbow extension,
push. Good. This one, push, hard as you can. Good job. Take your wrists and go up like this.
wrist
Don't let me press
extension,
them down. Keep them strong. Very strong. Good. Down like this. Don't let me pull them up.
and wrist flexion.
Very good. Fingers flat out in front of you like that. Don't let me press them down. Hold them nice and strong.
Finally, examine finger extension
Fingers wide apart like that. Don't let me press them together.
and finger adduction.
Like that. And like that. Very good. Relax. We'll test your reflexes up here, okay? So I'm going to use the big
Deep
reflex.
tendon reflexes are graded from 0 to 4.
Try not to concentrate on what I'm doing. Try and think of other things. Okay?
Begin with examining the biceps reflex bilaterally.
On this side. And do this one.
Then proceed with the brachioradialis reflexes
Good. Now this one is, I'm going to hold your arm up like this. Let it go nice and loose. Let me support all of its weight, like spaghetti. I know your arm's heavier than that.
and triceps reflexes.
Good job. This one, same thing. Nice and loose, like spaghetti.
You may also
Really
wish
heavy arm.
to examine finger flexor reflexes at this point in the exam.
Good job. Okay. Now we're going to test the muscles in your legs. Okay? So so we'll get you to lie down, actually. All right? There we go. Perfect. So, what I want you to do...
We will now move on to lower extremity testing.
Up off the bed.
Start by assessing strength, beginning with hip flexion, extension, abduction, and adduction.
Okay, you keep it up. Hard as you can. Hard, hard, hard. Very good. Relax that one. Same thing with this one. Lift it up. Don't let me press it down. Strong, strong, strong. Very good. Relax. All right. Now, I want you to try and press your legs down into the bed really hard. Don't let me lift them up. Strong, strong, strong. Very good. All right. And press your legs apart. Really strong against my hands. Good. And in. Really strong against my hands. Good job. All right. Let's finish testing those leg muscles. Lift this leg up off the bed.
Then proceed with knee flexion and knee extension.
Now, I want you, don't pull your heel to your bum. Pull it hard as you can. Pull, pull, pull. Good. Now push up like you're going to straighten your legs. Straighten, straighten, straighten. Very good. Relax. Put that one down. Let's do this one. Up like this. Bend. Pull your heel to your bum. Really hard. Good. And then push out. Hard as you can. Hard, 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 hard. Very good. Relax. Now I want you to point
Continue with
toes
ankle
up to the ceiling
dorsiflexion.
like this. Up to the ceiling. Up, up, up. Yeah. Don't let me press them down, okay? Keep them nice and strong. 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 Very good. Now this big toe here.
Extension
I want
of the
you to
great
keep it up.
toe.
Really strong. Don't let me press it down. Keep it up, 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 up. Strong. Stronger. I know you're stronger. Very good. This here. Keep it up. Very, very strong. Strong, strong, strong. Hard as you can. Good job. Now I want you to press down on my hand like you're
And
pressing
ankle
down
plantar
your back.
flexion.
Press hard. Good. And press here. Press hard. Good job. Now just relax. Let your
As
hands
with the
release
upper
when this one's
extremities,
ready.
assess for
Okay?
tone.
I'm just going to move them around. I'm going to move them around like this. Good. Now keep your leg nice and loose. There we go. Perfect. Good job. All right, now I'm going to bend this knee a little bit like this. And just relax your ankle. I'm going to move your ankle, okay?
In the lower limbs, it is important to assess for clonus,
And then
a
up like
rhythmic
this.
series of muscle contractions present when there is increased tone.
Good job. Perfect. Now let's do those reflexes.
Next, examine the lower extremity reflexes. This can be done lying down or sitting up.
Okay.
Proceed with the
I need you to
patella
do is
reflexes.
relax, just like you were doing when I was picking your leg up. Good job. Just relax. Bend your knee.
This is hard.
I know it's hard. This one. Just relax. Just relax. There we go. Now I'm going to bend this leg like this. Right like that. Okay.
And the ankle reflexes.
There we go. And this one here, same thing. Bend. Very good. All right.
Then assess the plantar response by stroking the lateral edge of the patient's sole in a J stroke from heel to toe using a blunt object, such as the handle of a reflex
You can
hammer.
laugh. That's totally
The normal response is for all toes to flex, called
very good.
a flexor plantar response.
Stretch.
When there is an upper motor neuron lesion, an abnormal reflex occurs where the great toe extends and the other toes fan out.
Legs nice and loose.
This is known as an extensor plantar response, or Babinski sign. Finally, test for crossed adduction.
Good.
The sensory
All right.
exam.
So I'll get you to sit up for me because we'll do the sensory exam. Yeah. Perfect.
Moving from the motor examination, we will start the screening sensory exam.
Lots of tools for this part.
Sensory information is carried to the postcentral gyrus of the cerebral cortex in two major pathways. The dorsal column, which crosses at the level of the medulla, and the spinothalamic pathway, which crosses almost immediately upon entering the spinal cord. Both of these pathways carry light touch sensation, and thus, light touch using a cotton swab or other soft object can be used as a screening tool.
Yeah.
Proceed by targeting specific dermatomes and test both upper and lower extremities. It is important to note that if an abnormality is found, the other components of the dorsal column and the spinothalamic tracts must be
The other
tested.
thing we can do, if you did have a
The
problem
spinothalamic
somewhere,
tract carries
okay,
pain and temperature
part of your hand is
sensation,
numb,
and so can be tested using sharp versus dull and warm versus cold testing.
I'm going to ask you to tell me whether it's pokey or dull. So this is pokey, right? And that feels kind of dull. Yeah?
Mhm.
Okay, so I want you to tell me pokey or dull. Sound good? All right.
Start distally and work proximally.
Pokey. Dull. Dull. Pokey. Pokey. Dull. Pokey. Dull.
Very good. All right.
Temperature can be done using warm and cold test tubes of water, or, more practically, a tuning fork can be used.
Is you're going to close your eyes. I'm going to put this.
The dorsal column carries vibration sense.
Stops buzzing.
To test
Okay.
vibration sense,
There we go.
place your finger below the joint being tested and have the patient state when they feel the vibration stop. Again, start distal and work proximal, comparing right to left.
Okay. Stop.
Very good. All right, let's do that on the other hand. Same thing. Okay, tell me when it stops.
Stop. Okay.
Very good. All right, we're gonna do just a tricky one, okay? And so it's just testing if you can tell where your finger is in space, okay? So now, look at your finger. I'm gonna move your finger. So you're watching. This is up, and this is down. Okay. Okay. The tricky part is you have to tell me whether it's up or down with your eyes closed. Okay. So close your eyes for me. Just relax your
The dorsal
finger.
column is also responsible for carrying position sense, or proprioception, to the parietal lobe. Isolate one joint and perform small movements to test this.
Let's do the other hand. Same
It is
thing.
important that
All
the
right?
patient
So we'll
describe
test same
where
way.
the distal
This
joint
way's
was
up,
moved to
that way's
and
down.
not the
Okay,
position that
close
the
your
joint
eyes.
finished in.
Ready? Okay.
Down.
Very good. That is perfect. We're going to do your legs now, okay? It's going to be pretty much the
After
same.
testing sensation in the upper extremities,
Hands, just
remember
right
to
here.
test
I want you to
light
tell me
touch,
the same
vibration,
size.
and
Just relax your
proprioception
legs,
in the
let
lower
them nice and
extremities.
loose. Okay? Tell me if it's the same.
Yep.
Okay. Okay. Very good. Real quick, we're going to do the same thing with the tuning fork and the toe. All right? Here we go. All right. So here's the buzzing. I'm going to put it here. Tell me when it stops buzzing.
Okay.
Very good. And we'll try the other one too. Okay. There's the buzzing. Tell me when it stops.
Okay.
Good. So now we're going to do the same thing in the toe with the up and down. Okay? So you can watch. This is up, and that's down. Okay? So I want you to tell me whether it's up or down. Okay?
Up. Up. Down. Down.
Very good. And the same thing with the other toe. Separate it up here. Okay. And this is up,
Up.
and that's down. Okay? You ready?
Up. Up. Down. Down.
Very good.
Lastly, parietal lobe function can be further tested using graphesthesia and
So now for this
stereognosis.
test, what I'm going to do is I'm going to draw a number for you on your hand. So you watch me do it with my finger. I'm going to go like this. What number is that?
3.
Okay. So now the tricky part is I need you to do it with your eyes closed. Okay. You ready? Eyes closed.
Graphesthesia is the ability to identify numbers or shapes drawn on the skin.
Okay, how about this one?
4.
Very good. How about this one?
8.
Very good. Okay. All right, another funny thing.
While stereognosis is the ability to identify objects placed in the hand.
Okay, so I'm going to give it to you in your hand with your eyes closed, and you have to tell me what it is. Ready? All right. Put it in your hand. You can close your hand. You can feel it. Just use one hand, though. This one has to stay here. Only use one hand. Feel it in your hand and tell me what you think it is.
A paper clip.
Very good. You can give it back to me.
Two-point discrimination can be tested by using calipers or a paper clip.
Feel it with your hand.
The fingertips should be able to distinguish 2 points at 2 to 4 millimeters separation. The final part of the neurologic exam is assessing the cerebellum.
Reflex hammer.
The finger-to-nose test is performed to test for dysmetria, which manifests as over or undershooting the target. In order to fully test the cerebellum's ability to modify movement, it is important to have the patient move through the full range of motion and reach complete extension. The cerebellum processes information from other areas of the central and peripheral nervous system to provide precise timing for coordinated and smooth movement of all skeletal muscles. Rapid alternating movement is used to test for dysdiadochokinesia. Be sure that the child lifts their top hand completely off the bottom one between each touch. Observe the patient's rhythm and accuracy.
Good. Are you left hand or right?
Lesions of the cerebellum manifest as ipsilateral disorders of fine movement, equilibrium,
Okay.
posture,
Now we have to do.
and motor learning.
So get you to lie back down. Okay. So now this one is kind of the same thing. Okay. What I want you to do is take this heel, pick it up, put it on this knee, and I want you to trace a very straight line all the way down your shin.
The equivalent tests in the lower extremities are the heel to shin test and the heel tap. Again, be sure to go through the complete range of motion. Observe the patient for accuracy and tremor while completing the heel to shin test.
Put it right here. Yeah. And slide all the way up to your knee and all the way back down. Nice and straight, and up one more time. Good job, and relax. Now this one, be careful that you don't hit your leg, okay? Because what I want you to do is I want you to take this heel, bend your leg, right here. I want you to tap on your knee like this. Just like you're going tap, 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 okay? And make it nice and big. No, just about like that, okay? But you do it by yourself, okay? Good. Good, keep on going. Good job. Perfect. Same thing with this one on this knee. Careful. Nice. Up and down. Tap. Nice big taps. Tap. 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 Very good. That's great. All right. Come up for me. Now we're going to jump down onto the ground, okay? Good. Just like that. So now I'll get you to turn this way. And this is a bit of a balancing act, okay? So I want you to put your feet together like this.
Balance, position sense, and proximal muscle weakness is tested with the feet together, arms extended, fingers splayed, and the patient's eyes closed. Watch for drift of the arms, away from the midline, as well as pronation.
Very good. That's
This test can also be abnormal in situations of increased intracranial pressure.
What you do is just walk across the room just the way you would normally walk, okay? Just walk all the way. Good job. And turn and come back to me. And just walk.
Lastly, have the patient walk, demonstrating normal gait. Have the patient walk on their toes, assessing S1, and on their heels, assessing L5.
Good. Stop. Turn around. Walk on your heels like you're a duck. Perfect. Now this is a tightrope test. What I want you to do is I want you to walk like you're on a tightrope. So heel to toe. Heel to toe.
Then have the patient walk heel to toe, assessing their tandem gait forwards and
And you can
backwards.
do that backwards. Try and do it backwards if you can. Yeah, all the way. Perfect, that's very good. You have good balance. All right, so I think that's everything for now, okay?
This
So let's go back
concludes
and
the
find your
screening
mom, okay?
neurologic examination in a child.